for the end. In a TPA, which you reconstitute with 2 cc's of sterile water. And then it needs, for the Baxter system, 5 cc flush. And what it does is, you're gonna put the TPA is gonna go like to here, and then you need the extra flush to go to the end of the catheter. We measured that one day, okay? If you have Fresenius attached to it, we were doing that in the office. We think another 5 cc, so 10 cc flush. Okay, because you don't want all the TPA in the tubing. You need it like just at the end to break up whatever clot is there. Now, the belly is sterile, so anything going into it needs to be done in a sterile manner. Again, washing your hands, tight-fitting gloves, wearing a mask, get a general feel. Where's my stuff? So when I'm drawing up heparinized dialysate solution, I do a 5-minute betadine prep on it. You're gonna have to do this on this here. So you wanted me to use one of these anyway. Here's the TPA.
So TPA needs to be ordered by primary team as stat. So like you tell the primary team, can you order TPA for me stat? So the pharmacy will send it up to you. You can order yourself, yeah. But then it will come out as powder. You need to reconstitute it in 2 cc, 2 ml of sterile water.
And there's directions here I have.
Yeah.
It says 2 mLs of sterile water. So to prep it,
Give it to everybody.
you open up the vial of TPA and 2 vials of sterile water. You need to do a 5-minute betadine prep. And this is where sometimes people in-house will get peritonitis, is because the prep isn't done. I touched that. You don't want to touch it, but I just kind of like do that, and do that.
Okay. For 5 minutes.
Okay, so we're going to get our syringes ready. I'm going to use one 10 cc syringe, and then I'm going to use one 3 cc syringe. I did bring needles. Okay. If you touch anything and contaminate, start over. That's where the peritonitis comes from. The 5 minutes is up. So you take a sterile gauze and you're basically gonna touch it in one spot and wick up the big bubbles of betadine. You don't want to dab it because you'll be dabbing the outside to the inside. Okay. Now, this needs 2 cc's to reconstitute.
So we'll get sterile water, 2 cc out of the sterile water bottle and infuse into the TPA powder.
Here's the TPA powder. Now, it wants you to really just swirl it to reconstitute it. I'm just gonna leave it like that for a minute. And you also need to draw up 5 cc's of sterile water to follow by it. Follow it to flush it in. Because you want the TPA to go to the tip of the catheter. Did I bring another needle? I didn't. This is nice and clear. You can see it. And when you draw it up, it comes out to a little bit more. And then we have the 5 cc's here.
And you say if you have a Fresenius catheter that's converted to Baxter, you need.
Then you would use 10
Then you use
cc's.
10. So.
Because it's a longer piece of tubing.
Mhm. Okay.
So here's our,
Catheter.
in our transfer set. You open it up. First thing you're gonna do is instill the TPA.
Yep.
Now let's see if you can see how far it goes.
So it doesn't go all the way to the end of the catheter
Right,
after the 2 cc. So you want to then,
this loosens later.
you want to follow it by 5 cc of
Sterile water.
water for a regular Baxter catheter, or 10 cc if it were converted from a Baxter catheter.
And then this is gonna bring it to the end of the coil.
Mhm.
Now, we have found it really needs
Overnight.
like overnight, 24 hours, sometimes even 48 hours to work.
Mhm.
So we often would send somebody home and then bring them back.
Outpatient. Yeah.
Correct. And in-house, you would do the same thing, just wait, give it a good 24 hours, then try the catheter and see if anything will drain out or fill. You can take your sterile syringe and draw back
Mhm.
and see if anything comes back, and then hook them up to a bag.
Mhm.
Sometimes I've actually had to give 2 doses of the TPA
Mhm.
before it will work.
So after the first dose, overnight dwell of TPA, if it doesn't work, call the PD nurse, let them know it's done one time. They may say, okay, try again, but we need to be aware if by that time the catheter still doesn't work. You try flushing, you try TPA, just not working, it may be a surgical exchange.
Right. You've gotten the KUB, you've gotten the clean out, and then if you look at some of that patient that's in